Hello, I'm Dr. Roy Picard, and I created this video for the residents of Troy, Michigan. What I'm going to discuss are the different types of tests that are often overlooked when it comes to helping a child who has either been diagnosed with or suspected of having ADHD. Brain function is the most important thing that needs to be addressed with these kids. In some of my earlier videos, as well as the information on the MichiganADDADHD.com website, I talk about the functional disconnection syndrome, which is common to all of these kids, and how important it is to get the brain balanced. And brain function is dependent upon two things, both stimulation and body chemistry. The body chemistry has to allow for proper fuel to the brain in order for function to be allowed to the brain at its optimal level. So how do I determine which areas of the brain require additional stimulation? There are specific non-invasive tests which are geared for specific age levels that pretty much tells me which areas of the brain require additional stimulation. Some of these tests will assess if there is a visual processing problem, an auditory processing problem, a motor skills delay, lack of coordination, a problem with timing or rhythm, deficiencies with fine or gross motor skills, and much more. Now, as far as the body chemistry evaluation or the metabolic analysis, again, it's pretty much dependent upon the ability of the child or age group, but we may need to look at such things as blood sugar, cortisol levels, the amount of good bacteria in the gut, if there's any bad bacteria or fungus or parasites in the gut. We may want to look at thyroid function or assess how well oxygen is getting to the brain. We can look to see if there's a high count of bacteria or viruses, check iron levels, look at liver function, immune system function, kidney function, and much more. What I want you to understand is this, that there is a great deal that can be done for these kids, but unless they're getting the right types of tests, unfortunately your child is not going to have that opportunity to truly reach their optimal physical, mental, social, behavioral, emotional, or even academic level of performance. Also keep in mind that these particular tests that I'm talking about, they truly need a functional assessment as opposed to just the traditional medical analysis. Now, for more information, you can go to Michigan ADD ADHD, and if you're interested in setting up a free consultation, then call my office at 586-726-9860. Again, we can schedule a free consultation. We'll sit down and discuss what possibilities are there to improve your child's function. Again, I'm Dr. Roy Picard, and what I do is above and beyond traditional chiropractic care. I wish nothing but the best for you and your child.